Hi, I'm Amanda and I have breast cancer. Um, this is kind of going to be a little bit of an overall of like where I am, how I got here, and yeah. So 2 years ago is where the story starts. So I was pregnant with my daughter, and at about around 30 weeks, it's so hard to remember now, which is why I'm documenting this now because I should have documented my pregnancy more. Around 30 weeks pregnant, I woke up one morning and my nightshirt was wet, and I was like, oh my God, what's happened? And so I had started leaking colostrum, which people do in their third trimester sometimes, and out of my right breast. And so I was like, oh, that's cool. I wanted to breastfeed, so I knew that was like a good sign. And when I, kind of was like, what's going on, and touched my breast, I felt a lump. And when you're pregnant, your breasts hurt and change. And so, I had not done a proper self exam, but had been, feeling my breasts. And it really did feel like this lump appeared overnight. It wasn't that there was a really small one that kept growing. Now, it may have been, but it felt, it's hard to remember now exactly, but it, it felt relatively big, like at least a blueberry size. I would think, it's hard to remember, but I feel like it was closer to a grape. And I was like, that's weird, but it appeared in the same breast that was leaking colostrum at the same time. So I asked my midwife, and she was like, yeah, that sounds like it's a breast milk thing. And I was like, okay. And when I would press on the lump, once I was told I could express colostrum, I would press on the lump and colostrum would come out. So I was like, yeah, it's a weird clogged milk duct. And honestly, that's kind of all I thought about it. It was like, okay, this is weird, gonna go away. Um, because I was pregnant and there was just so much going on. When I had my daughter, same thing. Like when I was trying to express, because we had quite a bit of time, had trouble getting her to breastfeed right away. I would squeeze that spot and milk would come out, and I was like, great, okay. So it kind of just became part of my like pumping thing until we figured out breastfeeding. Uh, and so it definitely got bigger when I had her, but I wasn't really concerned about it because, yeah, it's a breastfeeding thing, and I didn't really think of it. At her 6 month checkup with her doctor, I also had a doctor's appointment, and I mentioned it to my doctor and was like, okay, like, this is still here. That's weird, right? And she said, look, it's probably a breastfeeding thing. And by this point, I had Googled, and I did know that there were some things that kind of fit the profile. I had also read a lot that people who are pregnant, it's incredibly rare for them to have breast cancer. I'm starting to wonder if that's because being pregnant is such a small part of your life, and that's the issue, because I'm finding a lot of women that this happened to. Anyway, so my doctor was like, probably nothing, but let's do the whole thing and check. So she sent me for an ultrasound first. When I went for my ultrasound, the tech was like, yeah, I can definitely feel the lump, but I can't quite see what's going on. So she went and got the radiologist who came in and did an ultrasound herself. And she was like, yeah, like, I don't quite know what this is, but like, it doesn't look worrisome. And I said, cool. And I said at the time, can you do a biopsy? And she was like, no. No. And I've had a very good experience with this radiologist because I've seen her since, but she was like, I don't think so. And I know that there was some concern about doing a biopsy because I'm breastfeeding, because that can kind of spring a leak kind of thing, is my understanding. But she was like, it doesn't look worrisome, but like, let's do an MRI. That'll give us more information. I said, great. She said, look, if there's anything worrisome in the MRI, we'll do a biopsy. Great. So I get sent for the MRI with the contrast dye, and totally fine. No worrisome morphology seen is on my report. Yeah, it looked fine. Like, there was nothing. I've read the MRI report myself and the ultrasound report, nothing. I said, okay. You know, the ultrasound had been like, you know, I don't know what this is. So it was a little more concerning, I guess. It said that there was possibly sterilite features, uh, but the MRI was like, nothing. Don't worry about it. So I talked to my doctor and said, you know, okay, what's the plan? And she said, you know, we'll get better imaging once you're done breastfeeding. And I said, look, you know, my family doctor is also a young mom who's has breastfed. And I said, you know, would you stop, if this were you, would you stop breastfeeding to get the better imaging now? And she said, personally, she wouldn't. Obviously, she gave me all the choices. But she said, personally, no, like the MRI looks totally normal. I said, okay, great. But she did say, like, I don't want this, you know, she was great and said, I don't want this to just fall off. So let's send you to the breast clinic and see a breast surgeon. I said, great. So I went and saw the breast surgeon, who is the same surgeon I now have. And he was like, no, doesn't seem worrisome. Don't know what it is, but kind of know what it isn't. He didn't say that exact words, but that's definitely the vibe I got. But he said, you know, at that time it moved, which generally breast cancer doesn't move, is kind of hard and fixed. But it had all the characteristics of a benign thing. So he said, you know, we'll follow up in like 6 months or a year, depending on when you stop breastfeeding. Come back, let your family doctor know. I said, great. So I really wasn't worried about it. So I did wait a year. Well, I guess I didn't wait a year. The system waited a year. I waited about 8 months. Once I was done breastfeeding, my daughter abruptly stopped breastfeeding, which I now know is a sign. So at about the start of October, end of September of 2024, my daughter was almost 18 months, and she would not breastfeed from my right breast at all. And I thought it was because my nipple was starting to pull. Again, bad sign, but it had been checked and it seemed to be fine. I've now read that there's something called milk rejection, where infants won't breastfeed from a breast that has cancer in it because it tastes weird. And it's funny because I was really trying to still get her to breastfeed from both breasts, because I was like, you can't just breastfeed from one. And I think I put her off both, now looking back, because she definitely wouldn't breastfeed from my right breast. And then she just was like, nope, not having it. So at my next doctor's appointment a little while later, I mentioned it and said, like, look, can I get back in for another ultrasound? The doctor said, yeah, absolutely, now that you're done breastfeeding. So the ultrasound was scheduled. Actually, the breast clinic was scheduled first. So the breast clinic was scheduled for the middle of January. And now looking back, I wish I hadn't done this, but I had a job interview at the same time. And so I said, can I reschedule? I was, again, low risk, nothing. And it was supposed to just be the breast clinic. I wasn't told I was having an ultrasound at this point. So I rescheduled for a few weeks later. And a couple days before the breast clinic appointment, which was on February 11th, I had, through the health system, just a text saying, hey, reminder about your ultrasound on the 10th. And I was like, nobody told me that, but sure. So I went, did the ultrasound. The ultrasound text said, let me go see if the radiologist wants to see you. And came back and said, the radiologist is actually doing a biopsy, but it looks the same as last year. And I said, looks the same as last year? And she clearly was like, shouldn't have said that. So I got my guard down, because I was like, the same as last year was nothing. Anyway, so the next day I was waiting to have my breast clinic appointment, and I got a call saying, hey, the radiologist saw your ultrasound and just wants to do a mammogram. I wasn't concerned at all. I was like, yeah, last year they wanted an MRI. I was told that now that I'm no longer breastfeeding, I could have a mammogram, because they generally don't do that on breastfeeding breasts. And I said, great. So no problem, was scheduled the next morning. That didn't send off a red flag to me. I don't know why. So I went to the breast clinic, and the nurse that met me and gave me the gown looked like she had seen a ghost. And I was like, ooh, she's having a bad day. What's going on? She probably saw my ultrasound report. The doctor came in and was nice and, friendly. seemed panicked though. And that freaked me out. So she did an exam and she said, I know this isn't what you were planning on hearing today, but that's most likely cancer. And I said, most likely? And she said, yeah. I panicked and I said, but I'm young and I'm healthy and I have no symptoms. That's got to be a good sign, right? And I understand that she couldn't give me any guarantees, but, she was a little more pessimistic than I think she necessarily had to be. Look, I get it. She's a surgeon and she had a million appointments, but my appointment was like less than 5 minutes. And she didn't say, but there are great treatments now. And, she just said, I don't know when the biopsy is going to be scheduled. I'll send you for an MRI, but I kind of don't know. And she was good and gave me her office number and said if I had any questions. And it's like, any questions? You hit me with a truck. Like, I don't even know what my questions are yet. Anyway, so the next morning, my partner and I went to my mammogram, and the angel of an mammogram tech was there, and she knew I was nervous, and I just kind of explained it and said, I was told yesterday I most likely have cancer. What do I do? She was lovely. And so the radiologist came in and said, yeah, that definitely looks suspicious. And, you'll need a biopsy. And I said, I just can't wait. I'm going to go nuts. This is not okay. I need to know. And, they said, well, we have a very full schedule. It's like, I know that, but what can we do? And this angel of a mammogram tech was like, I think we can make it work if you come back in 2 hours. And I said, 2 hours is great. I can do that. So I went back in and they were able to do the biopsy then, which was really great. So they cleaned and froze my breast and did the first biopsy punch. So it's sounds kind of like a nail gun type thing. I'm glad that a friend of mine had warned me about that. So they did the first punch, was fine. Went to do the second, was not frozen. I don't know if it's because of the tumor or I often need more freezing than normal people. So they had to put a little more freezing in because I felt the second one. And they took, I believe it was 5 samples from the lump in my breast. And then the radiologist, he did take some samples from my lymph node, but they were kind of trash samples, just, he did his best, but they're little tiny things. And so when the biopsy came back, they weren't able to say anything really about the lymph nodes. They said they couldn't really find any cancer, but they didn't. It was a lot of muscle and fatty tissue from around and not a lot of lymph tissue. Because they are tiny. So the breast came back as cancer. So actually, I should specify, they actually had to do a biopsy of my other breast too, because I had a bunch of calcifications, but one clump of calcification just want to cover that. So that was the second biopsy. It scared the shit out of me. It came back benign though, so that's a different story. So my right breast came back as cancer. So there was an 8-day wait between being told it was most likely cancer and the biopsy results coming back, which isn't bad. It was 7 days between biopsy to results. My family doctor got me in and was lovely, was really, really great. Said, this is more like a kind of chronic condition now. Breast cancer is curable if we've caught it early enough. Whether, there's a lot of whether I'm early enough worry at this point because I didn't know. And, she was really great to say, there's a lot of treatments, you are healthy. A lot of the things that I wish the original surgeon had said, that there are a lot of treatments now, even if it had have spread, which it doesn't look like it has, which is great, and I'll get into, but so there's a lot of great treatments. So she had booked me in with a different surgeon, the one that I had seen last year, just because of scheduling and things, which worked well. And so I met him the next morning, which was great, with my partner. We went in and he said the same thing. He said, this is still curable at this stage. And, you are young, you are healthy. You know, I was 40 when I was diagnosed. I'm 41 now because it was right before my birthday. And I don't have any other health problems. I have hypothyroidism, but that's been well controlled for years. We just double checked my numbers and they're good. So, other than that, mild asthma, all of my issues are mental health, which, you know, obviously can impact things, but not in the same way as if I had a heart condition or something like that. Yeah, so the surgeon was great and he explained tumor board to me. So, every Tuesday at noon, tumor board meets. So that's the medical oncologist, radiation oncologist, and the surgical oncologist all meet together. I think over Zoom, but they, or Teams, whatever, they meet and talk about all the new cases. So it's nice. It means that your treatment is being designed by the team and having a team approach, which is really great because then you're not having surgery and oncology being like, which should we do first, any of that kind of stuff, which is great. So it was decided that it was going to be chemo first to shrink the tumor, and then surgery, and then radiation, potentially more chemo at some point. We're not quite sure yet. And I was like, great, when do we start? Let's start now. At this point, my MRI had come back and it had seen that 4 of my lymph nodes seemed a little too large, right on the border. So my understanding is the axis of lymph nodes is about 3 millimeters. So again, really small. Mine were 6, which is kind of right at the cutoff, which was alarming, but only 4 of the lymph nodes. I know that's still a lot, but we're going to take it because all of my other lymph nodes seem fine. Like, so my internal ones seemed fine. All the other ones, just these 4 guys right here. And then just more waiting. So then I was waiting for chemo and I was like, okay, I think I've processed this. I think I've processed that I have breast cancer, knowing that it's 4 lymph nodes and the size of it. So the size on MRI is 8 centimeters. It's huge. Knowing that, and now knowing that it hadn't spread anywhere, there's no sign of spread, that would make it 3A, stage 3A. They have never said that to me, but, you know, I can read the charts of how it works. So you get kind of points for the tumor size, any lymph nodes, and then if it's metastasized anywhere, you're automatically 4. Mine hasn't, so having a tumor that's over 5 centimeters plus lymph node involvement kind of pops me over to 3A. But they haven't said it. It really doesn't matter. You know, a lot of people have asked, and I kind of have been like, I don't know, but yeah, it would be 3A. We were hoping originally that the lymph nodes weren't, I'd be 2B, but you know, is what it is. Again, it doesn't really matter. So I was doing well with the diagnosis and feeling okay. And then they called me and said, hey, we're going to do a bone scan. And it was like my world crashed down. I'd obviously known there was a possibility that it could have spread, but that was terrifying. Suddenly realizing we have to look if it's spread because there is that possibility was, I think, too much for my little brain to handle. And that was the end of working. I had went back to work for a few days and been doing okay. And then it was, nope, not doing okay. So I had a bone scan 12 days after I had my MRI. So quite a wait. And then 6 days later, I had a CAT scan or a CT. And those were both to check if it spread. And for some reason, that just broke me. The waiting for that was really hard. So my oncologist appointment was booked 7 days after my CT to make sure we had the results. So I went and saw the oncologist last Tuesday, so a week ago. And she was absolutely lovely, just great. Had a great reputation anyway, and really, really lovely. So I met with her and, well, I met with an LPN first. That was great and took over my medical medical history. It was really good to put me at ease as much as possible. I got there, my blood pressure was high for me. Usually my blood pressure is low. My blood pressure was high, but she said, like, not worried about it because, of course, your blood pressure is high. You're meeting your oncologist because you have cancer. My pulse was 137. little high. But she said again, she was like, that's not indicative of heart or anything else. Like that's, which kind of is like, why are you testing it? But she was like, all right, let's give you a minute to calm down. I went over my medical history, and all I could think about was, has it spread? Right? That's all I could think about. I already know I have cancer. I know I'm going through chemo. I know I'm losing my hair, all that, whatever. But has it spread? The oncologist came in. She did a quick exam first, called my lymph nodes unremarkable, which I think is a good thing. Listen to my heart and chest and all that kind of stuff. And then sat me down and said, okay, so for treatment. And I actually had to stop her and say, I'm sorry. What, like, has it spread? Like a CT bone scan. And she was really lovely because I think she realized that for her, she had seen my results and knew they were fine. And so don't worry about it. For me, I didn't know. And I was living in that moment of, oh God. So she said, oh, they were fine, and said, like, let me double checked everything and said, no, they were fine. And I broke down crying. It felt like a 50-pound weight had been lifted from my chest. I was so happy. And that's probably not the reaction you usually have meeting an oncologist, but I already knew I had cancer. I knew I had chemo. I knew I was having surgery. I knew this was all hell. It was the unknown of, has it spread? So, of course, we can't guarantee it hasn't spread because they can't see every cancer cell. What they can tell is that there's no clumps of anything anywhere. So that's an incredibly good sign. So I was incredibly relieved and so happy. And then she was going over chemo side effects. And I'm like, that's fine. Like, I knew all that, right? I knew I was having chemo. I'm fine with that. I mean, I'm not fine with it, but, it's where I'm at. I don't want to be having chemo, but I have to, and that's fine. So I finally found out what type of chemo I'm having, which is, again, it's the unknown that's hard. So I'm having FEC-D, which means I'm having 3 rounds of FEC chemo. I'm not going to try to pronounce those 3 names. So it's going to be 3 chemos all at the same time. So I have it on one day, and then I have 20 days off. So it's once every 3 weeks. And I do 3 cycles of that. So I do that 3 times. And then they're going to switch to the D one, which again, I'm not going to try to pronounce. I know it's not the red devil one. So it's a different chemo. And I'll have that 3 times. So there's different side effects with each. So the first one makes you more nauseous. The second one causes more of the neuropathy in your hands and your feet. So we're going to be icing those. So 6 rounds in total. So 18 weeks of chemo. Then I'll have a short break to kind of recover and have surgery. I think due to the size, it would be a mastectomy. My family doctor did say, remember that they're going to be trying to shrink it. So, they could do a lumpectomy potentially. I don't want that. If I have any control, I will have a double mastectomy, but I know that they don't like doing that. So we'll see what happens, which I get. If there's healthy tissue, why take it out? So we'll see. But it'll probably be a mastectomy. I think I can argue for that. So what they do is they shrink it down first with chemo, which kind of tells you a couple things. So one, it's makes it a lot easier. Obviously, with such a large tumor, it's hard to make sure that you cut it out and have like clean edges, like clean margins around it to make sure that it's all healthy tissue around it. Because even if they find like one cancer cell, they have to go back and like scoop out more. So it makes it easier, obviously, if it's shrunk down. They did, when I had the biopsy, they put in a little metal clip. So even if it does shrink down to nothing, they know where that clip is. They know that that was part of the cancer originally to help scoop it out. The other thing of why they do chemo earlier that I understand from reading things is that it gives them a sense of how my body responded to chemo. So if they cut the tumor out first and then do chemo, it's hard to know if it worked on the cancer cells, right? So I'm back. So I was saying, if they cut the tumor out and so you can't see any cancer in the body, they do chemo to make sure that any kind of cells that were floating around are killed. But because you got rid of the big tumor, you actually don't know if that chemo worked or not. So now doing this first, they'll actually get to see whether the tumor shrinks or not. Because if the tumor doesn't shrink at all, they're going to be like, ooh, isn't actually killing the bad cells, which is part of why it's made it really successful, not just in the making the surgery easier later from having it smaller, but actually getting to watch the cancer shrink. Because yeah, if you take all the cancer out of your body, you're just throwing it at it and like hope it worked. So obviously that's really really helpful to know. So there's kind of two possibilities. There could be that the whole thing shrinks down and we'll be like, yay, it's working. But not everyone's just shrinks down to nothing, right? Like that would be unusual. It's possible that the whole thing will just go. Or it's possible it'll go by half, but at least there's some movement. It's also possible through this that the whole tumor isn't cancer. So I could actually be a lower stage, but we won't really know that until the thing comes out. So it's possible that it really did start as a benign lump. Because again, it's so weird that a year ago, no one was worried about it. And everyone's like, how did we miss that? And then they're like, well, we didn't really, it looked fine. So it's possible that it was a benign tumor, and some benign tumors can become cancerous. So it's possible that there's a big lump in there and either a few slow growing cancer cells or just eventually cancer showed up. So it's possible that like it's only going to shrink by half, but that's because half of it isn't cancer. So we'll see. So yeah, so we'll see how it goes. So hopefully it shrinks, but again, it's hard. Part of me is like, oh, I hope it actually wasn't cancer. It doesn't really matter at this point, but like part of me is still, I hope the whole tumor isn't cancerous, but we don't know. Yeah, so I'll do all this chemo, like I said, then a break surgery, break to feel, and then then radiation. So I have to go to St. John for radiation because there isn't any radiation at the hospital in Fredericton. So it's a little over an hour drive. So I'm going to have to do that for like 5 or 6 weeks every day. Which would be really annoying, but that's okay. We'll deal with that then. So all right. So a couple more details. So I am hormone receptor status positive. So that means that my tumor kind of grows on estrogen and progesterone. If you have any kind of hormone receptor things in your tumor, you're considered positive, but mine for estrogen and progesterone both scored an 8 out of 8. So mine are very, very hormone receptor positive. So that means that after I'm done chemo and radiation and surgery, they'll be able to put me on hormone suppression drugs to lower the amount of estrogen and progesterone in my body, and especially what my tumor can kind of absorb. And that will make it a lot less likely that my tumor will grow back, which is great. There is a status called HER2, and I am negative. So I have the most common type of breast cancer, which is hormone receptor positive and HER2 negative. So HER2 is a type of, I believe it's a protein. I can't quite remember now, but it's something in your body that helps because, you know, you want cells to divide normally. But if you have an extra copy of this, then your cells divide a lot more. So it's harder to, it makes your cancer grow faster. So it's a good thing that mine grows slower, but it means I can't benefit from the newer treatments for HER2 positive because I'm HER2 negative. So I won't be getting that treatment. I should say estrogen and progesterone receptor positive cancers tend, again, to be slower growing, which is good. So generally, younger women tend to have more aggressive breast cancer, and I don't. I have kind of the lazy post-menopausal cancer, which is great. A couple other things. So there's grade of your tumor. So the grade of your tumor is based on 3 things. So one, it's like what your cancer cells look like under a microscope, how closely they resemble normal cells. And mine don't look anything like normal cells. So I scored a 3. It's like 1, 2, 3. So I scored a 3 on that. Then there's like what the actual nucleus of the cell looks like. I think is what the middle one is, and I scored a 2, so it's like it doesn't look as weird as the whole cell, but doesn't really look like normal cells. Luckily, the third one I only scored a 1 on, which is, I don't know. I'm relieved by it. I think it's an important one, which is how fast my cells are dividing. So I can't remember the exact unit, but if it is 9 times or less in whatever metric they use, you only get a 1, and mine was less than 4, which is great. So I have really lazy cancer. So it looks really weird, but is super lazy replicating, which is great. Which is also the thing that it grew incredibly fast for having all these slow cancer things, which is also something that makes me as a layperson question if the whole tumor was always cancerous, because it grew quite rapidly in 2 years. At least I think so, for having all of these slower growing functionalities. So that's what I know about my tumor. So like I said, I know it's large and lazy, which is, you gotta have cancer, have the lazy kind. Yeah, so I will do an update video on Friday with what I learned from, or after Friday, what I learned from chemo orientation, and if I find out when I'm going to start chemo. Oh, one more thing. Sorry, I'm getting a port put in. So you can get chemo. Sometimes you have to do a port. They didn't actually say for me if I had to or not, but I want one. So chemo can go through a vein depending on the type of chemo. But because you're getting so much blood work and so many treatments, they often put in either a port, which is a little implanted thing under your skin in your chest, or a PICC line in your arm. So my oncologist actually recommended a PICC line. It's the only thing I kind of went against her on, but she got why. So a PICC line has less scarring. It's on your arm, and on the last day of chemo, the nurse can just pop it right out. And a PICC line is surgically implanted. So it's under the skin, and it to be removed, there can be quite often a wait. So there's a wait to take it out, because of course putting it in is urgent. Taking it out actually isn't. It can stay. It just needs to be flushed once a month. For me, I don't like when I have an IV in my arm. I don't like being able to see it, knowing that it's half in, half out. Don't like that at all. Makes me really squeamish. So the idea of having a PICC line in my arm also makes me very squeamish. The other thing is, so a port is under your skin, so you're able to go swimming, you're able to take a bath, which I love. A PICC line, you'd have to have incredibly wrapped to go to even the splash pad with my daughter. So it just didn't feel right in that way. The biggest reason for me, though, is I have a 2-year-old. She pulls my hair. She's going to pull PICC line. So the oncologist was like, here's why I think a PICC line is a better idea. And I was like, cool. I have a young child. I don't think it's a good idea. And so I said, look, if there's a medical reason why you think that the PICC line is a better option for me, happy to hear it. If it's just that it's going to be a pain in the butt to remove and I'm going to have it flushed once a month, I'd personally rather the port. And she was really, really supportive of that and completely got it. The other thing, my understanding is the PICC line has to be flushed once a week. So if on one of my good weeks before chemo, I want it to go away for a week, I might not be able to, because I'd have to have it flushed. That's really a secondary reason. But the biggest thing is, like, toddler. Toddler. My daughter will not understand not to touch it. Like, we'd work on that, obviously, but, and just even rolling around in bed, like, I just, nope. So waiting for my port installation date too. I did say if there's going to be a wait for a port, I'm happy to do the IV regular first. I don't want it to delay my chemo, or if they have to put a PICC line in short term, that's fine. But they said it shouldn't be too bad, so hopefully I'll get that soon. All right, I will try to edit this up. I have never edited a video before, so putting these pieces together. And yeah, like I said, this is not going to be a professional YouTuber production. But I wanted to kind of capture how I'm feeling now, and yeah, because it's funny. I get a lot of people being like, "How are you feeling?" It's like, oh, other than the anxiety and the whole like your whole life just stops, I feel fine, right? I have a tiny bit of a cold because I have a toddler, but I feel fine, right? It's all right now just anxiety because yeah, I was having no symptoms. Like obviously I knew the lump was there. But other than that, feel completely fine. So it's very weird to feel completely fine and be preparing to feel sick due to side effects. So it's a very weird thing. Anyway, I will update after my chemo orientation appointment on Friday. Thanks.